Have you gone to your physician and they've ran a whole bunch of labs and the doctor came back and said, well, everything looks fine, but you know something is wrong? If that's the case, functional medicine may be what you're looking for. Hi, I'm Dr. Nina, and here on my channel, we use functional medicine to get to the root cause of your health concerns. Some of the things that functional medicine identifies that allows us to get to the root causes that's not seen in conventional medicine is, first I'm going to start off with just like testing. Being able to have access to various forms of tests so that we can not only do blood testing, which is typically done in traditional medicine, and you know, I've looked at many different labs and I can tell you that these labs are basic and they're not really showing you, okay, what your toxicity levels are, how is your pH balance, what your immune system is doing, not just like your white blood cells, but the overall immune system. Being able to take a look at your gut in relation to your immune health and say, okay, is this person having a thyroid condition because their gut is unhealthy? Or is this person feeling tired because I see that their pH balance is off, but their inflammatory markers is high? So functional medicine allows you to have all of these tools in your tool belt so that you can actually help someone not only feel better, but actually get some of these biomarkers under control. And what I like to say is we don't like to look at our clients and say, oh, this person has a disease. We like to say, okay, this person has an imbalance and we are helping them with this imbalance, and we're going to give the body what it needs so that it can go into the proper healing state. Okay, so one of the things that functional medicine labs do is that functional medicine labs can detect certain things that traditional labs cannot. And the reason for that is that in traditional medicine, the metrics is based on insurance. I would say the insurance standards. So as long as you're fitting in the box, what I like to tell my clients, you could be on the box on the high side, you could be on the box on the low side, but as long as you're fitting in that box, in most cases your physician is going to say that you're okay. Now, in functional medicine, the metrics is optimal for your health. So our numbers are going to be either higher or lower than what you see in traditional. And the reason why that is so important is because we can see where you're headed, and traditional labs will not tell you where you're headed. So if I'm testing someone's, let's say, A1C marker, that's the marker to see if you're pre-diabetic. Now that's one of the markers that you'll see when you go to your physician, maybe for like your annual checkup. We'll take it a step further and, okay, I want to see what your insulin levels. I test your insulin levels along with your A1C markers, and your insulin levels is creeping up, then I can forecast and say, okay, you're headed towards insulin resistance. So you may not be pre-diabetic right now, but if your insulin markers continue to go up, then you're going to be knocking right on the door to become pre-diabetic. So we can forecast things. Another way that I would say functional medicine labs differ from conventional medicine is with hormones. So I can do a hormone test, whether it's blood testing, saliva or urine, and depending on what I'm looking for, I can get a more accurate assessment if I'm doing, let's say, saliva testing for your cortisol levels, and I can say, okay, hey, I can tell that you're tired. The client don't even have to tell me that they're tired. I can tell that you're tired, and some of my clients say, well, how do you know that? Well, because I'm looking at your cortisol levels, I'm looking at your adrenal function, and I'm looking at a hormone, and all of these metrics are either low or high. And just by looking at this, I know how you feel. So functional medicine, it paints a really clear picture from what I like to tell my clients, top to bottom, from your neurological system, your gut on down, as to like what's taking place in the body. So I've had a client that came to me because they were hypertensive and under a lot of stress due to losing a loved one. So how I helped this client using a functional medicine approach was, of course, I did a lot of labs on her because I wanted to see what was going on in the body. So we did a urine test, which is an organic acid test, and that test is going to tell me what's happening in her gut, but it's also going to test some of the serotonin markers and serotonin dopamine markers. So these are some of the emotions, especially because she was under a lot of stress due to loss of a loved one. And then some of the labs that I ran, of course, I test all of her hormones. I did her regular CBC, which you guys would know, CMP, all the way on down from hormones, immune system, nutrient deficiencies, and gut health. And I took all of that information and I used both tests, and both of the tests painted a really clear picture as to, okay, I could see why she was hypertensive once I found out the type of foods that she was eating, but I also could see that her ratio of her potassium levels were not the best. Sodium levels was extremely high, in addition to, cholesterol numbers was just like off the charts. But I knew one of the first things that I really had to tap into is I had to tap into the emotional piece, because I knew that this client was really hurting because she had lost her grandbaby. And so I gave her some support as far as like giving her some nutraceuticals that I knew that would help suppress past the brain barrier, which is, I don't know if you guys are familiar with L-theanine. L-theanine, lemon balm, journaling was huge. I wanted her to journal in 2 styles of journaling, in future tense, because I wanted her to journal how she wanted her life to be now that her grandson was not there. And I also wanted her to journal to her grandson as if she was speaking to him, and also be out in nature when she would do this. So she started doing this, and I would say within 2 weeks she came back and she was starting to feel good. And then so I added some more things. I started like giving her some things to kind of like tap into her health. I wanted to get the cholesterol levels under control. So we took some natural nutraceuticals to help with that. And slowly but surely, the more this client came in, the more she started to feel better. And not only was she feeling better, but when I retested her, I saw that these metrics was coming down. And if you guys are wondering, okay, why did I focus so much on the stress piece in the beginning? Because when you can calm someone down and reduce the stress in their body, you're also going to reduce the inflammatory markers in the body too. You're also going to have a client that's more compliant. And I just wanted to meet her where she was at. So that was a really great success, and I'm still working with this client as well, but so far she's doing good, and she's able to get back to work. Now I have another client who came to me, and she had just finished chemotherapy. So this was a cancer client who refused to take tamoxifen. So tamoxifen is the prescription that they give you once you have completed chemotherapy for breast cancer or various types of cancers. And what it does is it reduces the estrogen inside of your body, so that the thought process is that you keep estrogen levels down, then you won't have a reoccurrence of cancer. Well, this client refused to take the prescription, and she was sent to me. She's hit by her pastor. So same thing, I did a whole bunch of blood tests on her, and I also did a urine test. Now the interesting thing with this client is that the urine test showed that she had a lot of chemicals in her body, and one of the chemicals was a type of lead. So I asked her, I was like, it's your house. Tell me about your house. Is your house old? And she was like, no, my house is not old, but she was like, I was working in this school, and the school was very old. And she was like, she had one of her friends prophesied that she actually caught cancer from being at the school. And just so happened one of the chemicals that we found in this urine test was chemicals that came from paint. So she was sure that that was the reason, that was one of the causes of her cancers. Well, I took her through a detox and to kind of clear out some of the toxins from her body, as well as I had this client coming in every single week because she was on shots for her immune system, her gut health, and then we also needed to get nutrients in her system. And I took a natural approach, and because remember, she did not want to take the prescriptions for her estrogen levels to be reduced. So I put her on natural supplements that will do the same thing. And the reason I'm not mentioning those supplements because I don't want anyone that's watching this video to try to do this on your own. Like, if you do this, you do need to be under supervision, and keep in mind that this client had several testing. So I was actually like monitoring her like every 2 months, doing testing to make sure that we were like flushing out the bad estrogen, keeping those markers down. This client did so well within 6 weeks to where her oncologist released her from the program. Now that's unheard of, because normally an oncologist, you will be with your oncologist for quite some time after having cancer. Her doctor told her, like, whatever you're doing, I want you to continue to do this. And she feels really good. And one of the things that I told her, I was like, hey, we got this cancer thing under control, but I don't want you to get comfortable. I need you to eat right. And that's another thing too, is that we are really focused on like what you're eating. We want you to make sure that you keep the inflammatory foods down, because cancer can come back. Cancer is a condition not only due to, let's say, bad hormones, but we also don't want it to come back somewhere else, because now your cells is, where cancer lives, is now your cells is now in an unhealthy state, and you're creating an environment for cancer to come back. So this client is still with me, and we are working on other things for her right now. She wants to lose weight, so we're helping her lose weight, but we have had great success helping clients that have inflammation or have autoimmune conditions. Now I want to talk about another client. This client came to me because she was experiencing hair loss, as well as she has PCOS. So some of the things that I look for when a client comes to me for PCOS, for sure, I'm doing labs for your gut, because I know that most women who have PCOS is going to have some gut issues, hormonal imbalances, and then we start tackling these things, which is when the labs come back, I'll be able to see, okay, what is the first thing that I need to work on? And we did, of course, diet change. We worked on gut health, because there was a lot of things that was going on in her gut. One of the tests that come back that she had H. pylori, which is a really bad, I would say, bacterial infection that you can get in your gut. And most people will get it from unclean water or traveling abroad. But we were able to get her on a protocol for 3 months, and we got that under control. And then we start giving her some things that will help with her hormones, as well as I was monitoring her insulin levels. Because what can happen if you have PCOS, you are more at risk of becoming like insulin resistant, because certain hormones, such as like the androgen hormones, helps to regulate your insulin levels. And if those hormones are not, I would say, at optimal levels, then your insulin level can start creeping up. So we put her on a nice protocol. We were able to get her, I would say, her hormone markers under control, decent, so that she was not experiencing hair loss. And of course, her gut health was really good. This client as well started to lose weight, because why? We tackled the reason why she was putting on weight, because she had a lot of gut inflammation. So functional medicine, guys, is the future of medicine. There are so many, I would say, licensed physicians who are not practicing with their licenses, and who is moving on to functional medicine so that you can really treat your patients. So I'm just happy to be blessed and have a PhD in functional medicine, and to be able to help people. If you've gone to a traditional doctor and you feel like you're not getting the answers that you need, and because you know that something is missing, or you just don't feel right, or if you've been on a prescription for a very long time and you are like, you know what, this is not my life, I know that there has to be another way, then functional medicine may be for you. If you're looking for a functional medicine doctor, I am a functional medicine doctor. And if you would like to see more of these videos, please like and subscribe. And until next time, guys, take care.